The Martinis Telemedicine Panel, Dematepa, is a non-profit organization whose mission is to bring and integrate information and communication technologies into the healthcare practice at all levels of the health system. Dematepa's activities stand upon 4 pillars. Although today's focus is only on the e-health teaching strategies and learning tools, the topics of such teaching are rooted in 1. The everyday implementation of the healthcare practice from either remote or in-person or home-based consultations. 2. The research on cheap, lightweight, even portable medical electronic devices. 3. The editing of multimedias and podcasts addressing to the general practitioner for his professional updatings and to the citizen for his health education. At university level, Dematepa reckons that the interoperability of health operators is a major goal in advanced health systems, and therefore the students of all the faculty of health sciences are to be addressed in order to provide them of digital health common essentials, while starting from the 5th semester of their graduation course. All over the latest 11 years, Dematepa has been giving courses in several universities in 4 continents, as displayed in the map. Since the start occurred in the Amazonas State University in Manaus, Brazil, wherein teleconsultation was implemented as widely as over 1.5 million square kilometers, the pedagogic textbook was written in Portuguese language, and 2 years later translated into Indonesian language to follow the extension of the cooperation to that country. According to the Momentums, educational multimedia too were edited in several languages, namely Portuguese, Italian, English, Spanish, French, even with subtitles in Bahasa Indonesia. In the classification and logical sequence of the topics to be given, and therefore the frame of the index of that pedagogic textbook, it was realized soon that e-health implementation requires deep personalization according to the geographic, cultural, and health system setting. Thus, even some essential of health system analysis and knowledge management and communication issues had to be addressed in Dematepa's e-health teaching programs. For interoperability reasons among the several kinds of health operators, some topics are common to all the health science faculty. They can be named as core issues. On top of this, specific topics for each faculty are covered. For example, medical teleconsultation tools are specific for healthcare givers, such as medicine undergraduates, nurses, and midwives, whereas the flow of laboratory test reports, the privacy and security of databases are of major concern for biologists and public health students. Basically, Dematepa makes use of 3 learning tools: A. Lecture in presence, B. Lectures from remote, C. Guiding the students in the editing of multimedia with scientific context as a jointly made research. Let's make the example of the Faculty of Medicine. The students should start the course from the 5th semester, not earlier. From Monday to Saturday, a total amount of 18 hours of lectures in presence, around 3 hours per day, is given. Later on, 2 hours of practical exercise of asynchronous and synchronous teleconsultation per week, per 3 weeks, even from remote. Meanwhile, a relevant topic of medicine is selected. The screenplay on such a topic is drawn up and the multimedia is edited and published. In this example, clinical case of hyperparathyroidism, at the very end, a 1-hour test with multi-choice answers is given to the students either in presence or from remote to test the single student's learning. The second example is related to students of public health, nursing, and midwifery. 6-hour lectures of essential of computing sciences in presence, feasible even from the first semester, plus 12 hours lectures either in presence or from remote about specific competences from the 5th semester onwards. In this case, the example of multimedia focuses on neonatal mortality and practices of newborn resuscitation. At the end, the final test to check students' learning. The third example is up for students of pharmacy, biology and psychology. That is a bit shorter. 6 hours in presence about essential of digital literacy, even from the first semester, plus 3 hours lectures, either in presence or from remote, about data security, electronic prescriptions, digital signature, etc. As usually, the final test. To cover the students of all the faculties of health sciences, it is necessary to gather them properly and, above all, in core issue teaching. In this table, it is demonstrated as to how the entire e-health course can be given to all the faculty students in 1 week's time, provided lectures are given over the full day time, 3 hours in the morning and 2 hours in the afternoon.